It's 8 o'clock, and I talked to our person bringing the briefing today. I talked to her yesterday, so I know she's coming. So we'll just go ahead and talk a little bit about announcements, and I hope that all of you had great Labor Days. I brought COVID home as a souvenir for my Labor Day, but the good news is it's like a light cold this round for me. But it's on the rise again. I know lots of people who have it. As my PhD daughter would say, Mom, it's now endemic. And so it's become more of who we are, like flus and colds, and which is good news, according to my daughter. But I trust my daughter, right? So, any announcements that we have major announcement just around the corner is the Festival of Faiths. And I hope many of you have signed up to go. And I'm going to see if I can find it. I know I can find it online. It's no cost, but they are asking people to register. And they do that for safety reasons as much as for planning reasons, just to have an idea of how large the crowd is and how many people are there. I think last year it was something like 700 people attended. It was the very first year, which is a really great number for a gathering that's, first out of the gate in San Antonio. Could have easily been 70 people. Also a good number, right? But it was 700. So I know that they're hoping and expecting for many more this coming year. I'm going to get the URL for it so people can click on it. And if you haven't registered, you can go there. Now, the thing to remember with the Festival of Faiths is that there's also it's comes from we got the idea from the Festival of Faiths in Louisville. They've been hosting it for several decades now. And so don't get confused when you're trying to sign up. You need to look for the Festival of Faiths in San Antonio. So that's important. I did find, here we go. I'm going to show it to you. So this is what your link will look like when you get there. They have it's very rich, as it says, a rich tapestry of faith. But and they've got some of the highlights there, but it has every breakouts that include, dance and culture and foods, but also some very serious and in-depth conversations about where we are contextually in the world today. So they've worked a year at it. These are some pictures from last year. It's just a great way to get to know other faiths that are in San Antonio, build relationships. And I do know that there are people who didn't know each other before the Festival of Faiths who now know each other. And that's what we're all about here at the intersection. So I'm going to copy and put in this link for everybody. Stop sharing. Any other announcements that we might have today?
I've got one, and
Okay, Peter.
yes, Peter Nofre. Good morning, everyone. I wanted to invite everyone out next Thursday to the 24th annual 9/11 commemoration at the San Antonio 9/11 Memorial. It's on the campus of New Life Christian Center, and I'll put it in the chat, the directions or the address and such. We have this year, we have Mary Garr, who's a retired colonel, Army colonel, and also, of course, the CEO and president of Family Services will be our keynote speaker, along with Chief McManus and our new chief, Valerie Falcio. And so it's going to be quite the commemoration, but also we're going to have a special tree dedication, a groundbreaking of a tree for all those that we lost over the summer and the flood, and all the first responders, and remembering them as well, and acknowledging first responders. Just like on 9/11, we continue to do that work. So we just want to continue to encourage and invite everyone to come out and be a part of that very somber but yet inspiring event.
Yeah, it was well attended last year, I remember. And Mary Gar is a powerful speaker. It's good that you got her. She's doing some great work in our city. So, yay for that, Peter.
And thank you.
Well, thanks for doing that as well, helping us to remember, right? Never forget. Um, we could probably take one other announcement. I know that Jessie has arrived, so we could begin, but there's always room for one more announcement. All right. Well, we'll start this morning. We're going to get a briefing on what's happening in terms of mental health at the city of San Antonio. Jessie Higgins is the chief mental health officer for the city, and she did a presentation at the recent Pathways to Hope. And I thought we should bring this presentation to the intersection so that we can be updated on what's the city been doing and where it's headed in terms of mental health. Jessie, are you around?
Ready.
She's ready. And the screen share is now open.
All right. So yeah, like Anne said, this was a presentation that I really we were asked to do to show how the city and county is working together and the ways that we are pretty coordinated in our work and services and contracts we put into the community. So this is only a portion of what the city's doing and a portion of what the county is doing. But I do think it's a great presentation. We wanted to, we didn't, at Pathways to Hope, we didn't literally hold hands, but we sat very close. We made it conversational and we wanted to really demonstrate that this is an area where we get along and we're working well together. Um, I've been working as the chief mental health officer for this city for a little over 3 years. I started in the summer of 2022, and I'm the first person to have this job. It's the best job in the world. I feel so honored and privileged to get to work in this way for the city. And what's interesting is, of course, the city has had a health department for a long time. For 60 years, the city has been taking care of the health of the entire city and county area. Well, at the same time that I was coming on board, the county was building out their health department. After COVID, Judge Wolf really wanted the county to have some dedicated resources. And so while the county had had a behavioral health department for 15 years, it was under criminal justice, they decided to also create a health department and they moved behavioral health. So at one point, the city that's had a health department is showing like a concerted effort in mental health, and the exact same time the county's had a behavioral health department, and they are showing a concerted effort in public health, and it all happened in 2022. It's one of those demonstrations of how COVID really has changed the landscape of what communities really expect from local government. They expect local government to be able to do a lot, either in the public health space or the mental health space, behavioral health space. And so we wanted to show how we're trying and how we're working together to bring behavioral health into public health. And so that's really what this presentation is. It's an intersection of those things and the work that we've done in these 3 years. Let me see if my
And Jessie, the folks on this screen just really believe in that intersection between city and county and working together. So this is exciting.
Yeah, I'm so glad. And I see lots of names and faces that I love very much. So it's great to be here with you guys this morning. So this is the Metro Health vision and mission. Our vision is healthy people thriving in a healthy community. Our mission is to prevent illness, promote healthy behaviors, and protect against health hazards throughout our community through education, collaboration, and key services. You can see that mental health, behavioral health, substance use, treatment, and prevention fits right in with that. It's just not something that public health has traditionally done. Public health used to really focus on the downstream areas of risk behavior, disease and injury, and mortality. But in the last couple of decades in public health, we've really tried to move upstream and look at systemic issues. How does public health address social inequities and institutional inequities. And maybe we're not able to totally address those through public health services, but we're able to address that without framework, through policy. We're at least able to acknowledge that they exist and call on other parts of the community and government to work on those things. And then living conditions, like how far are you from a grocery store? How well are the sidewalks done in your neighborhood? Um, what kinds of media are you consuming? Does that contribute to a healthy lifestyle? And what's your schools like? How are you receiving healthcare through schools? Or are your universities, colleges, and public schools or private schools able to support like these types of healthy behaviors? And so really we look at the whole continuum right now in public health. And it's interesting to think about where behavioral health sits because behavioral health is knitted just like your physical health is throughout the entire continuum. And so we're constantly, we know we have a lot of things, a lot of people and crisis issues, but how do we also address prevention and behavioral health as well? One
It's
way,
a great chart.
yeah,
That
thanks.
was wonderful. Yeah.
Um, One way that we try to also understand our community is through this pair of ACEs framework. I'm sure a lot of you know about adverse childhood experiences, which is a data set of 10 data points that if you have these experiences in your household under the age of 18, your outlook for your health, not just your mental health or your behavioral health, is not as good as if you didn't experience these things. And so San Antonio, unfortunately, or Bexar County overall, unfortunately, has a higher incidence of all of these adverse childhood experiences than the rest of the state of Texas. Now, there's some obvious sort of things that we can understand. We've got an urban core. We have a little bit more issues that gravitate towards cities than rural communities, but it's still something that we want to address. While we also look at the adverse community environments, we want to address again those systemic issues, those upstream issues, those quality of life, those social inequities, those living condition issues that are helping us understand like not just the households that people grow up in, but also where the households, the communities that those households are in. And so really trying to look at the whole continuum of people's experience and understand people in that way. So the county, Dr. Guerrero and I identified 3 key areas that we collaborate in and that we have a lot of synergy in. And we also kind of thought about them as when we think about that spectrum. So last year, I was in a city council meeting where Chief McManus was being asked to present on what the police force was going to do if there was a school shooting and how they were going to prevent mass casualties. And it was interesting because, and I love Chief McManus and I was there to support him, but most of the questions that they asked were questions that we in the health department, either myself or our violence prevention public health administrator, Erica Haller-Stevenson, had to answer because a police department is going to stop an act of mass violence. But a health department or behavioral health services or mental health services or other interventions are going to stop people from feeling like that is their only option that and that is an action they want to take. And so really I was looking at wow, like this is a police department presentation, but most of these questions need to be answered with services and specific interventions and strategic prevention measures to where no one wants to walk onto a school campus and commit an act of mass violence. And so we put together this Bear Area School Safety and Mental Health Summit. It was amazing. It was last November. I think Anne was there, but I think some of you were there. And we had about 150 people there, all the school districts in Bexar County, which if you know, it's 17. So it's a lot of folks to coordinate and get in the room. Their superintendents, their counseling departments, their police forces. We had our local, we had the police department, fire department, we had the sheriff's department. We had philanthropy, we had nonprofits. We even had the FBI, the Secret Service, and the Department of Homeland Security. And the types of conversations that we had in that room and the things that spun off for that, we ended up doing an advocacy day in Austin where a lot of us went and took that to Austin and talked about like certain bills that they could enhance, the school safety and mental health bills that they had from the previous legislature that they could enhance in this legislature. And it was cool because we looked at our budget and the city's health department, and my boss said, I think we can do this every other year. And when I just said that to the county, because we were the ones who kind of came together with communities and schools in Region 20 to plan it, they said, well, we'll do it the other years. And so now we're working on that collaboratively, where the county is putting that on this year. And I would say footing the bill for that this year, but we're all working on it together. And so that was just a really cool moment of like, no, we all agree that this is important. We can do this seamlessly, and we can collaborate on that. You may know that the city and the county both have signed on to opioid settlement funds, to be paid out of these lawsuits that were taken against pharmaceutical companies and pharmacists and even individual doctors who were overprescribing opioids. And it's been interesting because we've gotten monies at different times, but we've really tried to look at a collaborative approach of what are you going to fund and what are we going to fund? What do we need to take care of as a community that's going to reduce the risks that comes from drug and alcohol use, and that's going to reduce the use of drugs and alcohol. Both of those things. We want to reduce risk for people who are using, and we want to prevent, first-time use if we can. And so we've both adopted a very similar framework of prevention, intervention, harm reduction, treatment, and recovery. And then, of course, there's some administrative costs in that as well. And I'll talk through those a little bit more. And then we both have multidisciplinary 911 response teams. The county's is called SMART and the city's is called SA Core, and I'll talk through those in the next couple slides. So this again is some pictures from the Bear Area School Safety and Mental Health Summit. We really wanted to bring mental health of school-age children as a public health priority, strengthen school safety by supporting a comprehensive system of care, which includes mental health, and to identify next steps. And then this is some information about national fatal overdose data. I kind of joked that it wouldn't be a public health presentation if I didn't bring you some data, some CDC level data. You see that nationally fatal overdoses have declined. And that's truly, and they seem to still be trending that way. And that's truly because of Narcan. I mean, there's an amazing anecdote that if you have an opioid overdose, Narcan can reverse that if you're given that anecdote fast enough. What we see in Bexar County, if you see over here on the right side, is you see our opioid overdose also has gone down, which is amazing. We don't want to stop, right? We need to keep our foot on the gas and keep getting Narcan out in the community, keep getting folks trained on it. But what you also see is that in Bexar County, we actually have a higher rate, you can see right here, a higher rate of stimulant-related mortality. So this is non-opioid, this is more like meth, likely, that people are dying of a higher rate from a meth overdose than they are, look, and you can see our line is the teal line. They're dying at a higher rate of a meth overdose than they are in the United States as a whole, and then in Texas also. And they're dying at a higher rate than they are with opioids. And so we're very careful, and this is a concerted effort that we've taken, both the city and the county. We're very careful that we talk about opioid settlement funds because that's the funding that we need to, make sure people understand that that's how we're spending this money. But when we talk about our work in that, we talk about it as all substance use. In Bexar County, this is from the medical examiners. We have more actually of a fatal problem with stimulants like meth than we do with opioids. And so that is a like public health, data-driven communication policy decision that we're very careful about. We don't have opioid programs, we have substance use programs. We don't have an opioid spending framework, we have a substance use spending framework where we're talking about how do we address these issues tailored to the needs of our community. So these are the type of works that this is what these mean: prevention, primary prevention, education and training, intervention, outreach, screening and referral activities, harm reduction, reducing risk and increasing engagement into services, treatment and recovery, getting people into treatment, but also supporting recovery. We know that people who are in recovery, recovery can be very fragile, and recovery can also involve relapse. And so we want to support recovery. And then, of course, administration, getting some administrative support for staff, consulting, research, and evaluation to make sure what we're doing is on track. I see your comment, Kendra. I'll get comments up there. I'll get your questions at the end. And then finally, we have two very similar teams called SMART and SA Core. SMART is the Specialized Multidisciplinary Alternate Response Team. It's Bexar County Sheriff's Officer with either a Bexar County EMS or Acadian EMS, depending on which side of the county they're on. Obviously, they work with the county. And CHCS provides the clinicians, and STRAC does some overall like backbone support and data support. And for the city, it's SA Core, and we've got the police department, the fire department, me as the health department rep, and CHCS again, and STRAC. And so what you see is you've got an officer, a medic, and a clinician. They wear the same shirt. They're clear about who they are, but they're trying to be their uniforms are soft uniforms, not hard uniforms. And they're trying to make people feel comfortable and approach a 911 call in the least restrictive means, right? They want to respond in this way that's going to get people in a behavioral health crisis to the place that they need to be because they've got a clinician at the forefront. We want to reduce unnecessary arrests, and we want to increase access to outpatient services. One of the most important parts of this team is the follow-up clinicians. Both teams have follow-up clinicians. The SMART team also has follow-up peers. And so anyone that gets seen is getting routed to follow-up services. So I love this timeline. In October 2020, SMART launches its first team, which was just 8 hours. And then they moved that team to 16 hours in August of 2021. Then we launched our first team. You can see on this timeline, we're kind of ping-ponging lessons learned and building incrementally off of each other. It's amazing having STRAC and CHCS as that like common factor in both of these teams. They've got a lot of lessons learned, and we kind of compare data. Like we had 30% of calls that ended like this. Well, kind of SMART has similar numbers. Well, that's really great. The consistency, that makes sense for our community, I guess. So in April 2022, we launched our first team at 16 hours. That was just in the center city of San Antonio. Then SMART launches a second team at 16 hours. Then we were able to launch 3 teams at 16 hours to cover all of the city. Then we went in July of 2024 to 24/7. We went overnight. And so 24/7 coverage citywide. And then October of 2024, SMART was able to go 24/7 countywide. So at this time, you should have, if you are calling 911 for a mental health crisis, you have access to anywhere in our county, you have access to this level of response if they're available. We always like to be very careful to make sure people understand they've got to be not on another call, right? And so right now we're doing over 700 911 mental health calls are being addressed by either SMART or SA Core every month over the county. It's actually, I'll tell you all this, it's actually closer to 800, but we're still, I didn't want to like overpromise, but we're doing a great job, and it's truly amazing to see these teams that have come up. And so that is sort of all I have, but I'm happy to answer questions. And if you have anything for the county, you can still ask, and Ann and I will make sure that we get those questions answered by the right folks.
Jessie, this was so amazing. And I just want to remind everybody that this is recorded by sacred.org and then posted. And you can take this presentation then and utilize it in your organizations, your congregations, with teams, with family, whoever might be interested and need to know this information. It's such a great presentation. It is amazing, and I'm so excited to see that growth over the years between the county and the city. So thank you for doing that. Do we have any questions or comments out there? Jessie, you did such a great job.
Thank you.
We do. Alice has her hand up, and then Kendra.
Hi. Yeah, great presentation. Really enjoyed this one.
Mm.
The other one too, but I like the personal on this one. But for the summit, please let me know if y'all need help with organizing all of that. I would love to be a part of that and definitely to provide some cards and everything there during the summit. But let me know how I can help.
Thanks, Alice. Yeah, we appreciate it. We didn't bring any, it was really, we kept everyone in the room all day and we didn't bring in any tabling or anything like that because we just wanted people to talk. And so
Right.
I'm not sure exactly if we do another smaller group like that and then start building it out. We've talked about breakout sessions, but it's like, I have the privilege, and I know a lot of you are like this. Alice and I know each other well because we see each other a lot. So I have the privilege of being in a lot of meetings. A lot of these folks in the school safety and mental health summit types don't, right? They're a counselor that works at the school. They're an officer that works at the school. They're a mental health officer. They're not in meetings. They're not seeing the work. They're not able to make these connections. So that first year, and I think this year too, we're like keeping people in the room and just trying to mix it up and get people to talk. But I mean, you realize how much like my job is meetings and I love it. It's not a complaint. It's wonderful. It's just a lot of people's job is doing the real work and not being in the meetings. And so getting those people to connect. Just kind of on the same line before we go to Kendra, I see a question. And is there a direct connection between the mental health group and the educational districts? So there is, but it's not strong enough. And the city and the county both had put a lot of ARPA funding that is what was one-time federal funds that we've stretched out, but is ending next year into school-based services and school districts. And so that was one of the ideas is like, let's use these, like if we can't preserve funding, because we can't print money out of air, unfortunately, I feel like we could, but we can't apparently. Can we preserve these relationships and get like people to talk? And so that's one of the things that we've tried to do because there is some connections, but again, getting the right people who are actually providing services, who might actually do a screening tool on a kid who might actually show signs of violence or signs of severe mental health issues, to understand all the resources that are out in the community or the way that the police department or fusion center would treat that kind of person. That connections, I will just say is not strong enough. And I think everyone would say it's not strong enough. So that's what we're wanting to build on.
And I think too, Jessie, one of the major things we talk about here at the intersection is community collaboration and how important that collaborating is, and that it's based on relationships. So what I hear you talking about is spending the time in the summits, creating those relationships so that part of it, and we all know that's critical, and that those get stronger. And you've got to take the time to do that. And in fact, it's a collaboration that brings about pathways to hope. So, it's, what comes first, the cart or the horse, right? But you've got to have those relationships to really go strong. Kendra. I assume she's searching for her. Here she comes.
Hi.
Hi.
So first of all, good morning, everybody. And I just want to say, I like literally everybody in this room, including the presenter. I see y'all everywhere. We are a community that really recognizes the root of all these problems and how they intersect, and is definitely one of the driving forces that brings us all together to address these problems. And then we kind of all go from there. So thank y'all for the work that we do together. Alice, I just noticed that you made a comment about being a part of this summit. I'm part of the planning if we're talking about the ESC 20 family summit, and I invited you and you said you had already talked to Rick and you were coming, I think. So if that hasn't
Oh,
happened, if you could please
okay.
follow up with me.
No,
Okay.
it's a different summit, Kendra. There's
Yeah,
two.
I think that
Okay.
one's different.
Okay, sorry. Okay. Never
Yeah.
mind. And then also, my question to you is about the amphetamine overdoses, just because I found with my sister who started her addiction through being overprescribed opioids, right? Because of her heart issues and the recurring surgeries to deal with that, and the pain medication that was prescribed to deal with that. Her addiction started with opioids. But was it she started using amphetamines, I think, because she started to not feel and she needed to be up and at sometimes. And then I feel like a lot of people that I've met in their addiction as well also have co-occurring substance use disorders where they're using meth and they're using opioids because they want both of those feelings because they've lost feeling. Is some of the amphetamine addiction, and maybe this is a moot point because people are just dying, right? But I'm just curious, is it because they're using both, like
Yeah.
amphetamines and opioids together?
Yeah, so look at this chart that shows that like polysubstance. So polysubstance just means multiple. So if you and this is death. So unfortunately, substance use data is really hard to get. It a lot of times, I mean, people are just not going to be super clear about everything that they're using, and that's okay. I will also say we've seen with the rise of fentanyl and things that people don't know what they're using. Pills, and I'm not being cute about this, but pills are not what they used to be. Pills are not someone's sort of stolen grandma's Vicodin or someone's Adderall prescription. Like pills are not like people don't exactly know what they're using in the same way that they maybe did, I don't know, 10 or 20 years ago. So if you look at this chart about this is from the medical examiners and this is from deaths, and so these are fatal overdoses. But you can see there's not a lot kind of on this side here, there's not a lot of overdoses that are attributed to only one substance. Most of the overdoses, most of the overdoses are attributed to multiple substances. 31% has a combination of cocaine, heroin, methamphetamine, or some sort of combination. And so, and you also don't see a ton of I mean, this is not a huge portion of opioid related deaths because Narcan really has helped if people know how to use it and people are around someone who's overdosing can administer it to them. If you don't know, Narcan can be administered through an injection, but really it can be administered through a nasal spray. And so that is something that any person can give to any other person. You don't have to be medical. I keep Narcan in my car. I mean, you don't have to, it's not even like, I mean, a nasal spray is pretty, like you can receive a nasal spray without having to swallow a pill or get an injection. So, yeah, I think what you talked about how people maybe start with one substance prescribed or otherwise or legal. Put alcohol in there. Alcohol is a depressant, just like an opioid is. And a lot of times then people need something to help. Like if you're overusing alcohol or opioids, even prescription ones, and you need something to pick you back up, then that high from a amphetamine or from a narcotic like cocaine can be very attractive. And so I think, what you're talking about is important for lots of reasons. It's important to like understand how drug use can happen, but I think it's also to understand how dangerous it can be when I don't know, even just we want to be very careful even with prescribed drugs or even with legal things like alcohol. I mean, we have a high DWI and fatal DWI and death by alcohol as well. And so in San Antonio. And so those are all sort of indicators of a drinking problem, I would say. And so I think it's important that we understand to be measured with those things is all I would say. I mean, I'm never going to tell someone not to take medication as prescribed. That's definitely way out of my scope of practice, but to understand sort of the risks, but also to like really have a lot of compassion and reduce stigma for people. A lot of people's addiction has started in something that a trusted medical professional told them to take and gave them because they were in physical pain. And that's really, people experience a lot of shame and a lot of judgment when it really originated from a place where they thought that they were doing, or where they were doing exactly what they were prescribed and told to do by a doctor. And so, yeah, I appreciate your point, Kendra, on a lot of levels, because it's important to understand. It's important to understand the science of addiction and how polysubstance use becomes can feel very unavoidable in some situations, but also just have that compassion and like stigma reduction kind of look at like, okay, but also very realistic look of like, okay, this is what you're dealing with. How do we deal with it? Because it just compounds and compounds.
Jessie, how does alcohol enter in on your chart here?
It doesn't, because this is pulled just directly from the deaths by drug. I'm sure there are, I mean, alcohol would be poisoning, not overdose. It's a little, for the medical examiners, it'd be a little bit of a different chart, but yeah, it's not on here. But if you look at our rates
Okay.
of DWI, DWIs, DWI related crashes, and alcohol related deaths, we're pretty high.
Where would we get that information? I think maybe a presentation on alcohol abuse would be beneficial. Who would I
I
talk
mean,
to?
I would talk to Cicada. So Cicada is the San Antonio
Okay.
Council for Alcohol and Drug Awareness. Rise Recovery also, but Cicada does a needs assessment every few years. I mean, they have that for sure. And they have some pretty staggering statistics about, age of first use of drinking or drugs and how that, I mean, that's a whole different
Mhm.
that all informs this work, I would say. So Cicada would be a great.
Good. I'll
I
check
see
on that.
Bill, if you want, look your hand up.
Who has a hand up?
Bill, but
Oh, Bill Neely? Bill?
unmute Bill. Oh, you're muted, Bill.
There we go. There we
You
go.
came on your camera, but then there you go.
So, my question is about the harm reduction programs, and so I'm wondering if that is adding into, in addition to Narcan, if that's adding into the reduction. And I know that those are under some scrutiny at the moment, and maybe, I think there's two, Corazon and Bark maybe, that are doing that. And I'm wondering if how have you seen those impacting this, and what do you expect to happen to those programs in the near future?
Yeah, so how long do you have? No. So let me talk about harm reduction. So harm reduction is a term, it is a practice. It means a lot of things to a lot of different people, just like the word treatment. Let me tell you, we got a room of substance use treatment providers together, and we tried to define prevention, and it took us like 10 hours, and I think we just got worse. And so what's prevention? What is prevention? Preventing a death? Is prevention preventing someone from ever using in the very first place? Is prevention keeping drugs off the street so that no one even could use? I mean, it's all those things, or it's one of those things. And when you try to do prevention, it's hard. So harm reduction is kind of the same thing, where it's this idea that we should reduce, that we can maybe not keep people from using drugs. Maybe there's not this fighting gravity for some folks, but that we can reduce harm. And I'm going to say that harm is going to be whatever you want it to be in one definition, whether it's reducing death. For a lot of folks, it's been reducing the spread of communicable disease. We know that if you're sharing needles, that's HIV, that's hepatitis, that's all these other communicable disease. We also know that sexually transmitted infections have a higher rate of spread among people who use drugs. And so it's those kind of diseases. And then there's wound care issues. And then you can even pull back harm even further and make harm, you know, losing your job, losing your relationships, things like that. So in the state of Texas, harm reduction more narrowly applies to things like syringe exchange. So programs that can hand you a clean needle when you hand them a dirty needle. And then that is mostly what we've kind of narrowed down harm reduction to mean. In other states, harm reduction could mean supervised use sites where they have a place where you could come and you use your own supply. And maybe there's a paramedic there to make sure that you don't overdose. Maybe they have other states have drug testing strips so that you know what's in your drugs. Like I said, we have a lot of unintentional fentanyl overdoses. We've seen a huge spike of that. That's part of where that spike came from. If in my chart, like in the 2015s, 2016, 17s, that was a huge spike of fentanyl and people not knowing what was in their supply. In Texas, supervised use sites and drug testing strips are not legal. And the only place in the state of Texas that it is legal to do a syringe exchange program is Bexar County. A few years ago, I think it was 2017, the legislature gave us, and it's not us, the city, it's specifically Bexar County. So the city cannot pay for the funds. Bexar County can pay for those syringes, but the city cannot. But we are able in our area to do a harm reduction program that's a syringe exchange program that could be funded by Bexar County. So that has been a pilot program. We are really trying to show that that is working. We we were able to use some of our opioid settlement funds and we gave them to the county and they matched them so that we're putting clean syringes on the street, but we're doing that through the county so that they're the ones funding those things. And so what happened is at the end of July, one of the things Bill is talking about is at the end of July, there was an executive disorder about discord on America's streets. And there's a lot of language in that executive order that made me, extremely sad and really sort of negative about the way that everyone is working on homelessness, from the person experiencing it all the way to like the outreach workers and the treatment providers and the policymakers around it. So it was not a super constructive thing, but it did mention harm reduction, and I'm putting it in quotes because those actual words, and supervised use sites as something that the federal government was going to be moving away from funding. So again, in Texas, we already do not have supervised use. It's illegal. No one is funding that here. In Bexar County, we are continuing to fund harm reduction because we are allowed to with our services. So I think Corazon Ministries kind of paused for about a week and ran it up their legal chain and kind of did some research and then decided, no, we're going to keep going. It is our dedication to keep going because we have seen that these practices work. We are maybe going to shift some language. Maybe we're going to start calling it risk reduction or an engagement. Maybe we can shift a little bit, but the actual practices, we have seen them working and we feel comfortable that we are within the legal confines of our federal government and of our state. And even what the executive order said is that they wouldn't fund harm reduction through federal funding, not that it would become illegal. And so, of course, everything will get worked out. We've seen courts and injunctions and interpretations that we have to keep getting figured out. But that is something that we are in lockstep with the county, and the way that we're going to continue funding using that framework. But harm reduction is kind of a complicated buzzword because it means different things to different communities in different states. And so that was kind of a long answer. But it is complicated and it is very frustrating when we've seen you save people's lives a few times through wound care and needle exchange and STI testing and Narcan and being there for them. And then when they're ready to go to treatment, you're able to engage them in a much more authentic way where there's so much more trust and their trusting of the system and all of that. It is something that is working and it's not something that we're wanting to or planning to give up on.
So thanks, Jess. We're at 8:45 and I really make a strong promise to stop by them, but maybe we can do two real quick. One in chat, it's what's the state of mental health counselors availability within San Antonio? And then Beverly has her hand up. So maybe we can do these really quick.
Yeah, so David, I don't know. That's always a tricky question because it's difficult with talking about funded versus unfunded or like that. I know that different studies say different things. I'm sort of a problem child where I have two mental health licenses, but I don't use either one of them. So when you're counting me, are you counting me twice, but I'm really zero for availability? But I think that what I'm hearing is that it's better than it was like in 2020, 2021 when everyone was trying to find a therapist. I'm hearing that it's better, and that more people have availability. And I think more people are going into the profession. So I feel optimistic about that. And then,
Beverly?
yeah, Miss
Let's
Beth.
just go to Beverly. That's good. Yeah, Beverly, we'll try to
So,
maybe do a follow-up on that.
Jessie, thank you. Which department are you in?
In the health department at the city.
You're in the Department of in the where?
I'm in Metro Health at the city.
Oh, okay. So, and so I just want to be able to tell you, it's just I I worked at SAMHSA for 10 years. I was over the Center for Substance Abuse Prevention, and I'm sharing this with you because we just came off of 3 weeks of trying to save SAMHSA, the Substance Abuse Mental Health, and the reason for that is because of the harm reduction. We literally lost an incredible agency, and the reason for that is because, as you spoke, it would be wonderful if people literally did just needle exchange and focused on that. But you have a whole continuum, like in California, where they literally set up places and people could just go in and get high, to the point that they were losing. It was like group deaths, and we lost because of the harm reduction message. It's very different to tell people you can. It's like being a little bit pregnant. You either are or you aren't. So instead of putting millions of dollars into actual effective treatment, and I'm not talking about just outpatient where people are going in and out for meds, but actually providing residential effective treatment that can help people get truly through their addiction, we were losing money to harm. So we just literally we got the Senate, and we actually turned the House to actually save an entire agency because of the nonsense associated with harm reduction. And I just want to be real careful, because what I don't want to see is our county targeted to lose all their federal funding. Either we have a continuum of prevention, and instead of moving money in terms of helping people, addiction is the hardest thing, one of the hardest things people have to achieve. And it's just very, very difficult to send a message, especially to our children. And we have shown surveys all over the country that say the children honestly look at adults, and with the harm, it's like either we use or we don't. Are you telling me I can safely use? How do you safely become addicted? It's just, and so I'm glad your spirit is wonderful, and I want to do everything I can do to help you. But I just have to caution you. It's like being, as I said, a little bit pregnant. Either you are or you aren't. And if we can focus in on helping people really prevent and actually putting money into real treatment, we don't have a single treatment unit in the city of Bexar County for young people. Not one. How do we do that? How do you not have a place for young people to get clean and sober? How? And yet we are willing to give money to people to give them exchange a needle for them so they can shoot up again. It's just, I will help you in any way I can to help prevent this, to help intervene. And, I will certainly, for years I did, even when I was in Washington, I always made sure San Antonio and Bexar County had lots of money to do the things we're doing. How can we be of help to you? Because we're reaching the people who really are on the streets, and it's so sad because all we can do, there's no place for them to go.
Yeah.
And recovery housing is a myth here. We literally opened up an apartment and put 21 women in so they could be there for 24 months with their children to be clean and sober. And we're the only one who is doing that. How do we get people to recover?
No,
Yep,
you're
and that's why the summit and other things are so important.
yeah,
Jesse?
and
Yes.
just real quick, and you're totally right, and I agree. We don't have any inpatient residential treatment for substance use for youth, and it's hard. There's a lot of systemic issues, and we want to keep hearing and having these conversations for sure.
Thanks to all. It looks to be a beautiful day, probably still hot, right? Take care of yourselves, take care of your body, your mind, your heart, your spirit. And that's how we heal ourselves, is if we're working on ourselves and working with each other, collaborating together. So thank you to all for what we do and what you do. Thank you, Jessie, for spending the time this morning. And you all have great weekends. And I'll see you next week at the intersection.
Thanks, everyone.
Thanks, Ann.
Well,
Thank you.
thank you.